Welcome to the Refusion Podcast, where we transform patient care.
Welcome to another episode of the Refusion Podcast. Again, here with you is Jennifer with my co-host John. Today, we're talking about something that's becoming increasingly central to healthcare, patient experience, and more specifically, why proactively asking for patient feedback matters more than ever.
That's right. Patient experience has really evolved into one of the most visible indicators of healthcare quality. While clinical outcomes are still critical, patients today are also evaluating how the entire journey feels, from scheduling an appointment all the way to post-visit follow-up.
And what's interesting is that this experience doesn't stay private anymore. It shows up in online reviews, survey responses, and shared patient stories, often before a new patient even walks through the door.
Exactly. In fact, many of the patterns we see in top-rated healthcare practices, especially on Google, are tied directly to how consistently they gather and respond to patient feedback over time. What proactive feedback really means.
Let's start with the basics. What do we mean by proactive patient feedback?
Proactive feedback is when healthcare providers actively invite patients to share their experiences after a visit, instead of waiting for reviews to appear on their own.
And that's a big shift from the traditional approach, right?
It is. When practices rely only on voluntary reviews, they typically hear from a small group of patients, usually those who had either a very positive or a very negative experience.
So essentially, you're getting a skewed picture.
Exactly. But when feedback is requested proactively, usually through a quick SMS or email sent shortly after the visit, it creates an opportunity for every patient to share their perspective.
And timing plays a huge role here. When the experience is still fresh, patients can recall details more clearly, which leads to more accurate and useful feedback.
Refusion's approach to feedback. Now, one example of how this works in practice is Refusion's feedback model.
Right. After a patient visit, a short survey is automatically sent via text or email. It starts with a simple question, rating the experience on a scale from 0 to 10.
From there, the process branches into two paths. Patients who give high ratings, typically 8 to 10, are encouraged to share their experience publicly on review platforms.
Which helps strengthen the practice's online reputation.
Exactly. On the other hand, patients who provide lower ratings are guided toward private feedback channels. This allows the practice to address concerns internally before they turn into public negative reviews.
It's a thoughtful approach because it balances reputation building with genuine experience improvement.
What patients actually prefer. Let's talk about how patients feel about being asked for feedback.
According to survey data, about 24.84% of patients say they appreciate when providers actively request feedback.
That might not sound like a huge number at first, but it signals something important. Patients increasingly see feedback requests as a sign that their opinion matters.
And when you combine that with the fact that over 73% of patients look at online reviews when choosing a provider, it becomes clear that feedback plays a major role in decision-making.
Why patients appreciate proactive feedback. There are a few key reasons why patients respond positively to proactive feedback requests.
First, and probably most importantly, it makes patients feel heard.
Exactly. When a provider asks for feedback, it sends a message. Your experience matters. Even if everything went well, that simple gesture reinforces trust.
Another big factor is timing. When feedback requests are sent soon after the visit, patients can recall details more clearly, things like communication, staff behavior, and overall flow.
And that leads to more meaningful insights for providers.
There's also the element of control. Patients like having options, whether to leave a public review or share feedback privately.
That flexibility reduces hesitation, especially for patients who may not feel comfortable posting concerns publicly.
And finally, many patients recognize that feedback can actually improve care, not just for themselves, but for future patients as well.
Benefits for healthcare providers. From a provider's perspective, proactive feedback has some very tangible benefits.
One of the most visible is an increase in positive online reviews. When satisfied patients are prompted to share their experiences, more of those positive voices become visible.
And that matters because review volume plays a role in trust. Data shows that over 31% of patients want to see at least 6 to 10 reviews before considering a provider.
Proactive feedback also allows providers to address issues earlier. Instead of discovering problems through public reviews, they can resolve them privately.
Which not only protects reputation, but also strengthens patient relationships.
Best practices for asking for feedback. So, what makes a feedback request effective?
Timing is key. The request should go out shortly after the appointment while the experience is still fresh.
Personalization also helps. Even small touches, like including the patient's name or referencing their visit, can make the message feel more genuine.
Offering multiple options is another good practice. Some patients prefer quick surveys, while others may want to leave a review on a platform they trust.
And clarity matters. When patients understand why their feedback is being requested, especially how it helps improve care, they're more likely to respond.
Addressing common misconceptions. Despite the benefits, some providers hesitate to ask for feedback.
One common concern is that feedback requests might feel intrusive or annoying.
But patient behavior suggests otherwise. Reviews have become a normal part of the healthcare decision process.
Another misconception is that asking for feedback will invite more complaints.
In reality, the opposite often happens. Proactive feedback actually creates a more balanced picture because it includes input from a wider range of patients, not just extreme cases.
And there's also evidence that engagement matters. Around 59% of patients say they trust providers more when they respond to reviews.
So asking for feedback and responding to it can actually build credibility,
turning feedback into better care. At the end of the day, patient feedback offers one of the clearest windows into how care is experienced.
It highlights everything from communication and scheduling to staff interactions and follow-up.
And when feedback is collected proactively, providers get a more complete and consistent understanding of that experience. Structured systems like Refugen's model make it easier to gather, analyze, and act on that feedback. Over time, that leads to stronger patient relationships, better care delivery, and a more trusted online presence. Closing. Ultimately, proactive feedback isn't just about collecting opinions. It's about listening, learning, and improving. And in a world where patient decisions are increasingly shaped online, that continuous improvement can make all the difference. Thanks for joining us for another episode of the Refugen podcast. We'll see you next time as we continue exploring how patient experience and reputation shape the future of healthcare.
Thanks for listening to the Refugen podcast, your path to better healthcare.